All right, you guys, so I am sharing some really good news. This video is going to go up after everything is complete, but I did want to make sure that I documented the process and documented my feelings throughout this process. Next week on Tuesday, February 5th, I will be having a facial feminization surgery. So I wanted to start out by talking about what exactly facial feminization surgery is. For me, facial feminization surgery is a list of potential surgical procedures as well as some non-surgical procedures that a doctor may perform to give a woman a more traditionally feminine appearance. I do use the term woman there because these are procedures that females who were born female can also get if, they just have genes or, a look that isn't traditionally feminine. If you have a woman who has a larger hairline or larger forehead, if she has a wider jaw, these are surgeries that females can get that will give them also a more feminine, younger look. So usually FFS, facial feminization surgery, is associated with the male to female trans women. But again, females can participate and can get any of the procedures that I'm going to list next. And they can be done in varying degrees, even to a man's face, to achieve whatever the desired effect is. Speaking of desired effect, I want to always make sure that your the first thing that I did, let me put it this way, was I set my goals. When I was looking at getting surgery, I looked at pictures of myself and I looked at pictures of myself next to women in my family. My nieces, my mom, my aunts. And I said, what are the things that I have going on that these women do not? And those were the things that I wanted to attack first. Those were my issues that I wanted to resolve or have resolved first before attacking anything else that was just purely, cosmetic or purely from a place of vanity. So there are several procedures that I'm going to go over with you now. I'm going to throw up some pictures because you guys can't see me because I'm post-op and I still have some bandages on. I won't be visually in a video for probably another week, maybe 2 weeks, depending. I am going to go over some of the surgeries and procedures that a doctor may suggest to you. What I always again suggest is that you know the things that you want to have done. A good doctor, when you go in, if you've done your homework, the doctor is going to confirm the things that you've already said to yourself. This is something that I want to have done. Now, the doctor is also, because they're a trained professional, they're also going to be able to go in and also suggest other procedures that will give you the most feminine look. But you want to make sure that when you go in that the doctor is picking up on those same things that were areas for you and things that you had in the back of your mind that you wanted to have done anyway. So I guess we'll start from the top. The first surgery is called a hairline lowering. Basically, and I'm going to go, let's kind of put these in an order here. Hairline lowering along with brow lift, brow restructure. Those I'm going to put in a category together because they're all going to come from an incision that goes from one ear to the other, like a headband. So you can have your hairline lowered while the doctor is in there. They can also do your brow restructuring as well as your brow lift, and any other forehead recontouring that they need to do while that incision is open. Just keep in mind that if you do that surgery, you will end up with a scar in your hairline. It could be slightly in front of your hairline, depending on where your hairline was initially. It could be slightly behind your hairline, but it will be something that you will need to navigate going forward. That incision, for me, is also very, it takes a little bit of a while to heal. You'll have some numbness in the top of your scalp. I have that now, and the incision itself actually feels pretty decent after about a week or so. But you will have some numbness in the top of your head and in the top of your scalp. I do want to caution you that if you get out of surgery and you can't feel your face, something may have gone wrong and you need to talk to your doctor about that. The next surgery that I'm going to talk about is going to be a rhinoplasty. Most of the time, this is something that a lot of, especially trans women are going to get. Men tend to have a more downturned tip to their nostril or to the tip of their nose, and tend to have a wider nose. And so in a process to feminize that part of the face, wanting to narrow the nose slightly and also to bring the tip up very slightly to give a more female and feminine appearance. Also, if you have a hump on your nose or any widening at the base where your nose, where the bone is, the bony part of the nose, the doctor can address that as well. And again, every woman who's gonna go in for FFS may not need the same rhinoplasty. So you want to make sure that you go in with your expectations set so that you're not getting what the doctor wants you to have instead of what you want to have done. In addition to a nose job or rhinoplasty, you can also opt for a lip lift. It just gives you a fuller mouth. It gives you a fuller lip. It actually takes a piece, usually maybe about a quarter inch to a half an inch of space from just underneath your nose, and it takes that out and brings your top lip up just a bit. And on younger women's faces especially, that is one of the characteristics that comes with it. Just having that higher upper lip, a little bit of fullness to it, and it just sort of curves up just a little bit. I'm going to go to now the surgeries that are done inside of your mouth. So you have your jaw restructuring surgery, and that's going to, or mandibular surgery, your doctor may call it, that is going to take away any wideness to the jawline. If it's necessary, the doctor may also do a chin augmentation, either to refine the chin or just make it smoother, a little bit more pointed, give you more of a heart-shaped face. Whatever needs to be done in there, the doctor actually goes in through your mouth into your jawline to do those surgeries. And if you have those surgeries done, understand that you will be on a liquid diet probably for about a week, maybe even 2 weeks, while those incisions in your mouth are healing. Some other surgeries or procedures that your doctor may ask you about, or you may want to ask your doctor about, are eyelid surgery, especially if you are an older person, if you're transitioning, in your 40s or 50s or beyond. It may be necessary to just kind of, pull your eyelids to have a more youthful, feminine appearance. Also, fat grafts or fillers around the temples, in the apples of the cheeks, sometimes even in the jaw area or corners of the eyes, may help to give you a more rounder, softer appearing face. Chin liposuction, as well as a trachea shave if it's necessary in your case. There are many trans women who, like myself, who don't have an Adam's apple. I've never had one. So that was not a surgery that I needed to have done. Also, other things like if you want to have dimples added to your cheeks, if you want to have any other types of injections or fillers done, lip injections or fillers, after or after surgery or during surgery, since if you're gonna get the lip lift anyway, why not go ahead and plump the lips up as well? Usually your doctor can do a little bit of lipo from like a thigh area or your back or something like that, and just add a little bit of fat to your face in different places to give you a more softer, feminine look. It's going to include nose rhinoplasty, nose job. It's going to include lip lift and also brow bone restructuring and jawline restructuring as well. And I wanted to be able to document this so that other people who may be thinking, other transgender women who may be thinking about doing the facial feminization surgery, you can definitely, get something from this. Even if you're just thinking about cosmetic surgery in general, hopefully you'll be able to get something from this. My doctor that I'm going to is Dr. Sheldon Linsenberg. And he is here in Atlanta, Georgia, where I wanted to find a really good doctor that came highly recommended and someone that was close. And luckily I was able to sort of meet all of those goals in Dr. Linsenberg. I am very excited about his expertise as a surgeon, and also his sort of bedside manner, his knowledge of the transgender community, and his desire and willingness to help people live their best lives as their most authentic selves. The main reason why I wanted to share on my channel is because I wanted to help other people who are contemplating plastic surgery, other trans women who are thinking about facial feminization surgery, FFS, in your research. And let me start by saying, do your own research. Look at this video as a springboard to you going out and getting your own information. Do not take this information as some sort of gospel, as some sort of like end all, because my journey and the surgeries that I did or opted to do are going to be different than what you're going to undergo. But in researching for myself, the doctor's procedures and expectations, I was shocked personally by the lack of information from trans women. There were several videos that I saw on FFS. There were several videos that I saw, a lot more videos that I saw on breast augmentation, a few videos on the gender reassignment surgery, but there were very few that were coming from trans women of color. However, I wanted to make sure that the information that I put out was sort of a complete start to finish of my journey, as well as background information. And when I looked at videos of women documenting their journey, a lot of times it included, this is what I'm doing and this is what I'm using, but it didn't include this is the entire, or this is a broader look at the female feminization surgery, FFS procedure. And so I wanted to make sure that I got that documented on my channel, so that way it was just a bit more complete in my opinion. I do want to give a shout out to two, trans women who have channels. If you guys have some time, definitely go and check them out. One of them is Life with Leah, and then the other one is Dawn Marie. Both of them are Black trans women with channels. I will link their channels in the description box so you can find them and support their channels as well. Really appreciate it. And certainly if you go over to their channels, leave a comment, let them know that you found their channel, from my channel, so that, they kind of, see that there is a community being built. I want to make sure that, we're building community here and building a sisterhood. So, yeah, absolutely. And if you guys have any questions or concerns about anything that I've said, definitely leave me a comment. I will definitely try to address any comments as they come in. You can also email me. I will also leave my email information to this channel in the description box. I look forward to hearing from you guys. And I also look forward to dropping the post-op video as soon as I can get this last bandage. My doctor made me wear my nose brace for an additional week. And so as soon as this comes off and I can get back into my regular skin regimen and all of that, and I will post a post-op video, and we will then do another question and answer at that point. So it's been great putting this together. I hope you all are having a great week. As always, kisses, and I'll talk to you soon.